Usual housekeeping. A fire practice is not expected. If the alarm sounds, can all present leave the building as quickly as possible by way of the nearest exit. A designated assembly point is the public square in front of CAS, beyond the fountain, away from the civic office. If there's anybody with mobility issues, please wait in the refuge area at the top of the stairs, where the emergency evacuation lift is located, and use the intercom situated to the left-hand side of the lift doors to call for assistance. No roll call will be undertaken. Thank you. I'll just obviously check that everybody's got the mobile phones on silent. The meeting will be audio visually recorded and will be available to view on the Council's website and YouTube channel. Can I ask all those present use their microphones when you're speaking to ensure that the audio is captured? Any members of the public entering the Council chamber are accepting that images will be retained and broadcast by the Council. So I'll just get everybody who's here to introduce themselves. I realise it's possible some officers may enter later on. But if I start right at the end with Martin, thank you.
Thank you, Chair. Yes, good afternoon. Martin Greenhouse, Ward Councillor for Tickhill and Wadworth.
Hello, Glynis Smith, Ward Councillor for Hatfield.
Councillor Majid Khan Bessica, Chair of Region and Housing.
Gemma Cobby, Councillor for Town Ward and Chair of Review and Scrutiny for Communities Environment.
Sarah Maxfield, Governance Services.
Councillor Jane Kidd, Chair of this panel.
Andrew Circum, Governance and Member Services Manager.
David Smith, Licensing Officer.
Hayley Oxley, Senior Licensing Practitioner.
Helen Jones, Service Manager, Youth Justice Service.
Andy Hood, Strategic Lead for Practice Improvement in Children's.
Claire Henry, Public Health Principal.
Thank you very much, everybody, and welcome to the meeting. So we don't have any public in attendance, so we can move straight on to the agenda. And item number... Let me get the... Oh, yes, sorry, Andrew. Any apologies for absence?
Councillor Leanne Hemshaw and Councillor Andrea Robinson.
Thank you. Anybody got any other apologies? Thank you. Consider the extent, if any, to which the public address are to be excluded, and there aren't any issues on the agenda. Does anybody get any declarations of interest? Okay. There's no public here, so we can now move straight on to the first agenda item, which is actually the statement of licensing policy, and we've got some questions. So I'll go straight into the very first question that I've got. And I think I know what I was referring to here with this question. I was very pleased to see a requirement for staff training. This must obviously be gambling premises. Can you just I was just sort of exploring the idea of whether links could be made. So staff are obviously in a position to sort of come across people who are very vulnerable, who may be going into sort of very testing situations if they've got a gambling problem. Are there any sort of possible links that they can be made to the wellbeing team to refer people on, or do they give an information? If anybody could talk about that, please.
Thank you, Chair. So the staff training requirement is mentioned twice in the policy, and both of those sections refer to consideration by the applicant when making their application as to what they need to volunteer. Or where an objection is received, it would come to the licensing committee and conditions can be imposed. So gambling operators have to adhere to strict requirements imposed by the Gambling Commission, which includes intervention and directing people to agencies who provide assistance to problem gamblers. So they are already bound by their own governing body, the Gambling Commission, to do that. The local policy, we can include sort of local gamblers anonymous and things like that, contact details, but as it's mainly for the applicants, the licence holders, they are already well regulated on what they have to do in regards to problem gambling. Thank you.
Can they actually make a referral and refer somebody on to support? Presumably that person has to be in agreement to being referred on.
Yeah, I think that's the key point. The person who has the issue has got to be ready to make that commitment to sign up to something like that. but it has to be done on a voluntary basis. They can give them instructions, directions, and all the help they would need, but ultimately, if the person chooses not to, there's nothing they'd be able to do on that front.
Thank you very much. Sorry, thank you very much for that. Got some questions from Councillor Cobby to follow. Thank you.
Thanks, Chair. And yes, I've got a few questions. First question is regarding to 4.11 in the proposed new policy. It mentions about travelling fairs, and my question is regards to, we talked about like monetary sort of gambling, but does that also, this policy also include non-monetary? It's like, again, one thing we passed a couple of years ago as council, but I know it was implemented by Cabinet, was to end prizes as pets. So again, like goldfish or anything other such as animals on council land, such as like travelling fairs. Is that also as part of this, or is that a separate policy?
Thank you. So equal chance prize gaming is where every participant has an equal chance of winning, and players are not played against a bank. So everyone in this room would have an equal opportunity. No one else would take a cut from that. So an example like that would be prize bingo. The types of fairground games where prizes have been traditionally given as live pets, goldfish, tend to be like the hook-a-duck, for want of a better example, which is more of a pay-to-play. So you pay your money and you keep going until you win, and then you win the prize. It's not a gamble. There is no loss. So in regards to pets as prizes, it's not a national thing, it is a local requirement. My understanding, it only relates to council land. So it would be at the point where the fairground operator goes to the council department and says, I'd like permission to use your land. It would be a condition in that agreement. It wouldn't be something for the gambling policy. And fairgrounds are largely exempt from needed any requirements under the gambling policy, so wouldn't even look in the policy for it, which is why it's not there. Thank you.
Okay, thank you. Yeah, just wanted clarification on that, so just to avoid anything coming out in the future regards to prizes. I assume that would be under enforcement and planning applications for that fair to take place. It would fall under. Okay. Following question is regards to 3.1, the changes. I noticed in the new proposal it's omitted the licensing chair to be part of that discussion regards to decisions whether representations or application for licence review should be referred to the licence committee and subcommittee. I'm quite concerned that, like, as part of democracy, that the chair has been omitted from that policy, and I understand that the chair of licence committee hasn't had any discussion on this new policy, so I just want to know what are those decisions for omitting them.
So the Gambling Act 2005 closely follows the requirements of the Licensing Act 2003. It came in a couple of years after, and it was a very similar process. Under the Licensing Act 2003, the decision to accept or refuse a representation is designated to officer level. The current delegation under the Gambling Act 2005 makes no reference to the chair of the licensing committee being involved in decisions on whether or not a representation is accepted or not. So the current version of the gambling policy predates the current delegation of power. So the policy has been amended to bring it in line, so it matches what current process is, in that the chair is not consulted. Chair and members of the licensing committee were included on consultation of this policy when it was done publicly, and the next step in this process of approval is to take that report to the licensing committee. So if there are any thoughts on whether that should remain or removed or be changed, that will be dealt with at the next committee hearing.
Okay, thank you. Yeah, for me, it'd be increasing democracy, because that's kind of where we're elected is to represent. And for me, I'd like to see it remain. And I think, yes, the national policies change regards to legislation, but I think we can always improve it on the local level. Yes, it's national, but we can always do better as well. And that not just on this policy, but anything else. So, following question I've got is, thank you, is there is a current restriction to the number of premises listed under 4.6 and 4.9 within the city of Doncaster. Is there, sorry. And how many premises are there in the city of Doncaster that fall under 4.6 and 4.9? What is public health's involvement on the number of premises and any future planning applications regards to like gambling in the city?
Thank you. So just to split that down into three then. So current restrictions on 4.6 and 4.9. 4.6 being adult gaming centres and 4.9 being betting premises. There are no powers under the Gambling Act 2005 to set limits on these kinds of applications and licences. So it's if an application is made, unless it's objected to, it would be granted. How many premises are there in the City of Doncaster that fall under each of those? There are currently 8 licensed adult gaming centres and 42 licensed betting premises. And the final point on public health involvement. So public health are not a responsible authority under the Gambling Act 2005, so cannot make an objection in their own right. But what we do as a licensing authority is consult with them, and any feedback they give to us, we would then make a determination. If we were going to object, we would use their evidence as part of our objection. We do that, we've done that for a number of years. Planning is separate to the licensing process. Often an applicant would go for planning first, but they can go for the licence first and then go for planning, but they are completely separate. So I wouldn't be able to comment on public health involvement in the planning side of things, but only on the licensing where we do consult with them.
Okay, thank you. I think for me, it's just knowing, like, obviously public health, I've got the data, particularly around addiction, and if there's a growth in area, again, like concentration of certain areas where people flock to. So it's always good to know that where those addictions are and how that goes into planning, and whether that's in the policy or not. But yeah.
Has anybody else got any questions? Yeah, Glynis?
Yeah, at 42 betting offices, I'm expecting that number a few years ago would have been very much higher than that. But I don't think anybody in the room couldn't be conscious of how much easier it is nowadays to gamble than ever it was. And my dad was actually a bookie, so I'm very much aware of, you know, the past and where we are now. You can't watch commercial telly for 10 seconds without being bombarded with bingo here and gamble on this. Have we lost control? And it just seems to be a growing kind of mushroom that gets bigger and bigger and bigger, and I can only see more issues with addiction going forward.
Yeah, so to answer your question, it's based on the legislation we've got. We can only work within those restrictions. All licensed betting operators have to obtain a licence first through the Gambling Commission, so they do all the vetting of the major operators. Local authority involvement is when they come to apply to operate premises within our borough. Where the Licensing Act 2003, which is for alcohol licensed premises, and the Gambling Act 2005 differ, is the Gambling Act 2005 specifically says that a local authority should look to grant any application which is made. That should be your starting point. That is the rules we are bound by, so we write the policy to fit those guidelines. So yeah, I can't say anything really on those points because they are government issues that we have to deal with. Thank you.
Thank you very much. The recommendation is we're asked to consider and support the adoption of the Statement of Licensing Policy 2025. Is everybody in agreement with that? Thank you very much, and thank you very much for attending. Move on to the Youth Justice Plan. I've got a question to kick off. It's about which of your interventions do you think are the most effective, and how could they be made even better? And I'd just like to say that we're very pleased to see this. We've talked a lot about the need for speech and language assist therapy, and I know it's referred to in the report, so you may want to bring some more of that out. Thank you.
Yeah, so my first intervention to discuss was the speech and language therapy. So that's a significant resource and intervention for us. We're able to offer that to every young person coming through the youth justice system. We offer an assessment. What research tells us is that young people open to the youth justice service have significant speech, language and communication needs which are not diagnosed. So they can have an assessment with us, and that assessment then informs work, not just with our case managers, with our young people, but it informs work in schools, other education settings. The recommendations from that report can be shared with those institutions to hopefully achieve better outcomes for young people. In terms of other interventions, we have psychology services. So that offers a range of psychometric testing for young people, looking at their abilities and knowledge. We have dialectical behaviour therapy, which helps young people manage strong emotions, to be able to emotionally regulate, gives them skills in which they're able to control their emotions better. And also within psychology service, we have harmful sexual behaviour intervention for young people who have committed offences in relation to sexualised behaviour. And that offers a specialist assessment of work in relation to that, and interventions such as on healthy relationships, for example. We also have systemic family therapy. So that looks at working not just with the children open to our service, but their families, their parents, wider family networks, looking at how relationships function currently, how they can be improved so that family functioning is better, again leading to better outcomes hopefully for those children and young people. And we can measure that with a tool which is called a Score 15 tool, which assesses where families are at the beginning of the intervention and at the end. So that gives us a clear idea of how effective that intervention has been.
What sort of restrictions have you got on what you can offer at the moment, and what would you like to do if you could?
So we have got a well-resourced youth offending service, but restrictions come into play where we've got such things as a single post, like the speech and language therapy post is just one person. So they've only got a finite number of hours that they work. And although that post holder is very dedicated and conscientious, you can only do so much with that.
Okay, thank you. It's interesting, the speech and language thing is so important. Thank you very much for that. Martin, you've got a question.
Yes, thank you. You may have covered some of it by saying you have sufficient resources, but the budget, is it sufficient to meet the requirements?
Thank you, Councillor. So in most years, yes, Doncaster YOS is well resourced both by the Council, the Ministry of Justice and the Partnership. This year, two very interesting things are going to happen. So firstly, the turnaround programme introduced just slightly over 2 years ago is intended to end its funding stream at the end of this financial year. And there are currently no published plans to expand that provision. The turnaround provision works with children before they even come into contact with the criminal justice system in most cases. So it's a very, very early preventative activity. We are awaiting a government announcement on the future of turnaround, but obviously with recess pending, it's unlikely that we're going to hear that till the autumn. So that is one potential pressure that children's services will have to evaluate and look at the impact of if it is not indeed refunded. The second relates to one of our commission services. So every authority in the country is required to provide an appropriate adult service when children are interviewed under PACE. We have been part of a sub-regional arrangement with all the South Yorkshire local authorities, commissioning an appropriate adult service first from an organisation called SOVA, which was subsequently bought by another organisation called Change Grow Live. Regrettably, after 15 years, Change Grow Live have given notice on the contract and will no longer continue to deliver this from November. So we're out on a national procurement activity to bring in a new provider to do this. Two providers have expressed an interest. The evaluation of their bids hasn't yet been undertaken, and that's led by Sheffield and will occur within the next 4 to 6 weeks. Both of those providers have a significant additional cost compared to what we were contracting for Change Grow Live, and that will put a pressure of circa between 31 and 41,000 on the youth justice budget going into next year. Of course, we don't know what the youth justice grant still is this year because due to the election, it wasn't published, and now being a week out from recess, I don't expect we will hear until September. They have given an indication that the grant will be no lower than last year's, but that is only an indication. We haven't received anything else so far. So there are two potential pressures, and I think we have to wait until the autumn to see what the current administration's intentions are as regards to funding those. If not, then we'll look within our own services about what we can prioritise and what we can deliver.
Yes, thank you for that. And I agree that, that until the autumn statement, the budget, it's all to play for, to be fair.
Thank you very much for that. Glynis, you've got a question. I think to some extent you may well have covered that with your question. Glynis, do you want to? Gemma, sorry.
No, I think Andy's covered it. Thank you.
Yes, I think we've... Has anybody got any additional questions in that case? Okay, thank you very much. Again, the recommendation, the committee is asked to support the Youth Justice Plan prior to consideration by Cabinet and Council. Is everybody in agreement? Thank you very much. Thank you. Thank you for that. Thanks a lot. Okay, we'll move on to the health and wellbeing strategy. And we've got a question. It is from Glynis to begin with. Thank you very much. Thank you.
What type of consultation has been undertaken, with who, and how has this been used? And could you explain further about how the voice of residents within Doncaster have been made a part of this strategy? What have you done different, and can you highlight the key findings, please?
So just to cover some of the information that was in the background paper that we did on the resident engagement, what we decided to do was work with the Integrated Care Board, who are in parallel delivering their 5-year one plan. So we thought it made sense when we go out to residents to talk about health and wellbeing board that we would do that together. So for residents talking about health, it doesn't matter which part of the system it is, they'll just tell you their story. So that's what we decided to do together. That started with what we've already got in place. So what have we already gathered? What have we already spoken to residents about? So we did that synthesis across a number of partners and organisations. So we pulled all that information together, going back probably, I'd say 5 years, looking at some of the key engagement that we'd already had. So that was across Ardash, Doncaster Royal Infirmary, St Ledger, through our own locality plan consultation, through the appreciative inquiry and the ongoing conversations that Doncaster have, and a number of other engagement that we've done. So we pulled all together and we did a workshop, and we brought all of those organisations, the kind of key engagement leads from those together to talk about what they felt were the themes that they were seeing and hearing within their engagement that they'd already done. So we gathered all of those themes together and thought, where is some elements where we might want to understand whether or not what we've heard is right, and if for any particular groups it was relevant to them as well. So Health Watch helped us to do some targeted focus groups. So we designed a methodology where we looked at the themes, came up with some conversation questions or discussion points to have with a number of targeted groups, so that we could just talk through some of those. So for example, some of the themes that we had were, as you can imagine, access to services. We had themes that were around mental health, so about prevalence of mental health needs or services and support. We had a theme around what we would call the wider determinants of health, or those building blocks for health. So people talked about transport and their environment, they talked about cost of living, but also about what services they could get and what help they could get within their local community. And some people talked about inequalities and fairness and wellbeing as well. So those were themes that we had, and we went out, Health Watch went out and had those conversations with those targeted groups. And then we pulled all that information together. And when we've looked at it and we've looked at that existing engagement, we estimate there's about 8,000 engagements when you look at that as a whole. So that's the information that we've used. That's gone back to the Health and Wellbeing Board members as part of their development session to understand that information alongside the data and the numbers that we use to look at the health and wellbeing needs. So all of that information was then considered by the Health and Wellbeing Board to then come up with the recommendations and the priorities that they've got within the strategy.
I mean, I'm really interested in the 8,000 figure because I've become very aware of figures since becoming the chair of Health and Adult Social Care, but also the Joint Scrutiny Committee for South Yorkshire, where we say we've consulted with groups of people and the numbers are infinitesimal, if I can use the best word I can think of. And you know, you wonder how much actual engagement has taken place when you look at the numbers of people in the whole of South Yorkshire. So 8,000 for Doncaster does seem to be quite impressive, looking at some of the figures that I've looked at for other places. But it's about, I suppose, whether the people that you were speaking to understood exactly what they were being asked, because it has occurred to me since not being professionally employed that access to health and other systems, if you can't articulate your needs, are actually quite difficult. And it's those people really that need to be reached.
So 8,000 engagements is an estimation of if we looked at all the engagement that's taken place across all of, say, Team Doncaster partners, and there'll be much more than this. Was just a snapshot. We didn't want to go back out and ask residents, you know, what do you want to see in a health and wellbeing strategy? Because we know that we've had conversations and there's been lots of engagement done in lots of different ways with lots of different methods. So we wanted to use that as the baseline rather than going back out, and just to avoid some of that consultation fatigue that we're getting back from residents saying, we've said this already, we've said this already. So we have done it in a different way. We've used that as the foundation. I should also add that we use the Fairness and Wellbeing Commission work as well as the foundation, because the health and wellbeing strategy does look at those wider determinants of health. They look at that kind of foundations for health rather than specifically on healthcare services. So we've done that in a different way. So yes, the figures look huge, but actually if you think about our age-friendly cities consultation, I think that was, let me just look, over 1,000 responses to that, and that again was done in different methods, but of online survey, but also face-to-face conversations. So we didn't ask residents, what do you want to see in a health and wellbeing strategy? We asked residents, what stops you from being healthy? What helps you being healthy? And those were the kind of things that we were looking at for some of those themes as well. So yes, it wasn't specifically for the health and wellbeing strategy, but we've used all of the engagement that we've done so far as that foundation. Is that okay?
Thank you. I think my two questions go together, really. It's, excuse me, when will the action plan be in place? How will it be monitored? And how are people going to be involved as it progresses? Thank you.
So the Health and Wellbeing Board is a partnership board. So this is a high-level strategic document to provide some areas of focus for the Health and Wellbeing Board as a partnership to come together 4 times a year to look at how they can lead collaboration across Team Doncaster partners. So they won't be producing a very specific action plan that has detailed interventions and projects that need to be delivered to improve health. That's the part of the whole healthcare system, if you can imagine. That's made up of lots of partners and lots of organisations. What the Health and Wellbeing Board have got these 3 areas of priorities, they'll be doing a deep dive into each of them. So for the 3 areas of focus, they'll do a deep dive and they'll be looking at the current state of play. So what is the context and what is some of the information, a bit more into the data, a bit more into the insight. They'll be looking at some of the things that are working well. What is the evidence base about how to approach, say, for example, the improving the experience of ageing, and then looking at recommendations to the whole system around health. So that may include a recommendation to a particular group of partnerships or boards to say, could you have a look into this element of work that we'd like you to do? Or it could be that they want to influence a new policy or strategy that's being developed locally. And the Health and Wellbeing Board may want to say, well, this is what we'd like you to consider in the bid to be able to improve health and wellbeing in Doncaster. Or the Health and Wellbeing Board may want to convene groups of individuals together or partner organisations or anchor institutions to then say, this is a sticky challenge for Doncaster, we'd like to come together and look at how we can provide some solutions to some of the health and wellbeing challenges that we're seeing. So they won't be producing a very specific plan around each individual project or intervention, but they will be producing maybe a plan or a framework of some of the ways that they're going to work and some of the things that they want to do to work together as they meet 4 times a year to be able to do that. One of the thoughts that we've had around progress is there's 2 products that we produce, I suppose, at the moment. One is the annual health and wellbeing report. So every year that collates all of the good work that's been going in Doncaster to meet health and wellbeing challenges. The second one is the Directors of Public Health annual report. And again, that talks about the progress of work that's been taking place to improve the health of the population. So those are the 2 areas that we can see progress. But also what we're wanting to do with the health and wellbeing strategy is make it much more accessible for residents. So to put it into language and into a way that people can really understand what the Health and Wellbeing Board is looking at. And so we're going to put that onto the Your Life Doncaster website as like a microsite, a little mini web page for the Health and Wellbeing Board strategy, but also the Doncaster's Integrated Care Board plans, because residents are very interested in access to services as well. So that's where that part of the system sits. So we want to do that in a way that's really easily accessible for residents, but also we can then put on there any progress, any key pieces of work that's been developed, anything that's new around health and wellbeing, and we can stick that into one place so that residents have got kind of a one-stop shop to be able to look at those opportunities, look at those if it's a new strategy, a new policy, or if it's a new service. So all that will be going onto that microsite, and we'll be looking at launching that in September after the health and wellbeing strategy is being approved at full council.
Thank you. Could you just sort of give me an example of something that the board might look into as a deep dive, some sort of subject area?
So they'll be looking at 3 areas of focus. So improve the experience of ageing. So they've looked at that, and they did that at the last board in June. In September, they're looking at closing the gap in women's and child health. And then in January, we were looking at creating healthy places for Doncaster. So they'll be doing deep dives on those elements of that work. So, for example, if I talk you through what the improved experience of ageing looked like, we had consultants from DRI, from geriatric consultants, come and talk about what they see in the hospital from older people accessing hospital, how that's not the best place for people to be, and that actually we want to see them be able to stay more independent in the community. We had information around the age-friendly cities work and all the resident voice that came with that. So that was a deep dive into all of the work that they've been doing, so we could hear resident voice come through around what it's like to age as an older person in Doncaster. And then we also had contributions from Darts, for example, who were talking about their work in keeping people well through being physically active, cognitively active and socially active through some of their activities, and how they have a challenge around scalability and sustainability in the way that they're funded, and how that could be improved for the future. So we do a little bit of, as I said, the data, the resident voice, a little bit about the evidence base and what's working well, and also then something around, well, inspiration and what does the Health and Wellbeing Board want to recommend for future.
Thank you. Yes, sir.
Yeah.
Thank you. Thank you for your answer. I'll go on to Glynis now. Thank you.
Thanks, Chair. On page 11 or 180, it talks about targeted support for those with specific health needs. So about affordable, accessible transport, and also it talks about easy read health information, which is clearly something very close to my heart. Can we expect this to happen in the very near future? And can we also expect some documented evidence of success, as I know it will be successful, and not just for the groups mentioned in the report? And, you know, what I do know is that easy read information is used by many more groups than it's done for. So it's used by, obviously, people with a learning disability or a learning difficulty. It's used by stroke patients. It's used by people with dementia, where English isn't the first language. You know, the confused elderly. It's used by huge swathes of the population, and I know it'll work. So how quickly can we expect this to be happening as routine for anything that we produce, and can we see the evidence of its success?
So in terms of the Health and Wellbeing Board and the strategy, definitely we've acknowledged straight away that we need to make sure that this is in a much more accessible format than, I suppose, previous traditional strategies are. So hence the description I gave you about Your Life Doncaster and a microsite and having that. So that will be taking place for the strategy. In terms of easy read across the board, it is something that the Health and Wellbeing Board could recommend to other organisations, partnerships, boards, to put into place. So in terms of services, that would be picked up by the Integrated Care Board through their One Doncaster 5-year plan. So that's one area that could have that recommended. And as they've been working on a parallel journey with the health and wellbeing strategy, they will have picked up those key themes that have come through, Councillor Smith. So around accessibility, around easy read. So that will be they should be picked up by the forward plan for the ICB to be able to do that into the services. But in terms of specifically for the Health and Wellbeing Board, there's definitely we have a community engagement report that was done a couple of years ago about how we engage more with residents with the Health and Wellbeing Board. And so that one element that we will be doing, as I said, in September is producing these documents in a format and in a way that's not just the traditional easy read as well, but is easy read in its broadest sense.
Anybody got any questions? Okay. Recommendation. Committee is asked to note and endorse the Health and Wellbeing Board's approach to the development of the strategy. Is everybody in agreement with that? Thank you very much. Thank you.
Thank you very much, everyone.
We've got final agenda item, overview and scrutiny work plan. Is there anything anybody wants to particularly raise? I know we've done some really good work planning. I think I've been to everybody's sessions. Probably got far too much work on. We're ever going to finish. Anybody particularly want to? Okay. I think that probably brings us to the end of the agenda, and I hope to see you. I know you can't attend, but we're meeting with the Mayor online tomorrow. I know you've got some work on, Gemma, can't be helped, but yeah, thank you very much, everybody. Thank you. We'll close the meeting.